You're watching TVC Breakfast. Nigeria has the highest burden of sickle cell disease in the world, with about 14 million people living with this disease.
It's also the top sickle cell endemic country in Africa, with an annual infant death of about 150,000, representing more than 8% of infant mortality in the country. As a result of this, campaigns for improved awareness are constantly being carried out in the country, as well as the kind of support needed by the warriors to help them live healthier lives.
Now, this festive season, the focus is on breaking the cycle of pain, and the Sickle Cell Advocacy Management Initiative is at the forefront of medical outreaches for warriors. And I like the word warriors. Oh, yeah.
Yeah, I'm sure it came with a point. It has a really heavy meaning behind it.
It's deep. It's deeper than just the word.
Right.
It's really interesting. Right. Joining us now is Toyin Adeshola, Director and Founder of Sickle Cell Advocacy and Management Initiative. Certainly that will be on Skype. We also have in the studio right now Maureen Wachi, as well as Larry or Layokun. Gentlemen and ladies, nice to see you both in the studio right now.
Welcome. Thank you very much.
Very good. Let me start, ladies first, so let's start with the lady. Now, Maureen, let me start with you here. Okay. Now, when it comes to the awareness of sickle cell, there has been advocacy over the years. How would you rate how aware Nigerians are about sickle cell?
I would say that Nigerians are still not very much aware about sickle cell disease, but we are getting there. We're getting there. Like in 2019, I would say we have recorded at least the highest number of warriors who have been able to come out themselves to advocate during the Sickle Cell Awareness Month, which is in September. So a lot of people are beginning to loosen up to talk about it more, but there's still work to be done.
Right, and well, let me get your take now. The theme for this period is breaking the cycle of pain. For many watchers, the assumption is that it's like a lifelong experience of pain, but now we get to know now that this year we are being offered that there is an option of painless sickle cell awareness, painless sickle cell experience. Is that what you're saying?
Yeah, what we're trying to say is that, okay, living with sickle cell might come with pain, but there is always a way to manage it. And that cycle will reduce, and you don't have to live with that pain. And that is what we're trying. That's why we say we're breaking the cycle of pain. Because majorly, most times, this pain is more out of the mental the mental angle, not the physical angle. Okay. So because like she said earlier, people, maybe because of due to stigmatization and co, find it hard to come out and say, okay, I'm living with this disorder. That alone in itself is pain. Yeah. Coupled with the physical part angle. So what
pain to the psychology of it.
Psychology of it, yeah,
okay.
Angle of it.
Okay.
So so what we're trying to do now is that though you have sickle cell, but sickle cell doesn't have you. So let's break that cycle, and then let's ease it. Let's let people know that, okay, you can live with sickle cell and you can live a normal life just like every other person.
Okay. Now, Maureen, let me come to you on this. The use of the word warrior, it strikes, it resonates with me. I love it. I really love it. But talk to us generally. What does it take to be a warrior in this case? A warrior, a general who is matching the army against sickle cell. Talk to us about it.
Well, we already know what a warrior is, like what you just said. But for warriors, we call ourselves warriors because we are constantly fighting for our lives, if I may put it that way. So we are constantly fighting from birth till death. We are constantly fighting to live, you know, because of the pain that sickle cell brings, the complications and all that. So you're constantly fighting to, you know, to live, to survive.
In that fight, what equipment, what arsenal do you need to fight that fight? I really want to know.
Well, like my colleague already said, you need a positive mindset to fight.
Number one, that's great.
Yes, positive mindset. You need a great support system, which is what we are trying to do with this outreach we are going to.
Should that be the family?
Yes, both from the family, support groups, so that people don't think they are alone all the time. They also see that this person also lives with the same condition and they are doing fine. And when it comes to the medical part, constant medication that needed for better life,
So you talk about positivity, a strong support system, and of course a strong system, health system, in the country. But in Nigeria now, what are the odds, against a sickle cell warrior thriving painlessly? I still want to use that word, even though it might not be the reality, because the idea now is to manage the pain. But what are the odds against you, emerging victorious in a system like Nigeria?
It's very difficult, I must say. It's very difficult. Like Larry already mentioned, stigmatization, discrimination, all that comes with it. So it's very difficult to actually live a normal life in Nigeria, because a lot of people still don't understand what sickle cell is. So that's just...
But are there facilities in place now? How strong is the system that, wants to change the narrative? Like your NGO, for example, now, how well entrenched is the NGOs, for example, now? Is this alternative system now to help change the narrative in the country?
Yes, this is an alternative system to help, change the narrative in the country. And when it comes to maybe other bodies like the hospitals, medical personnel, and all it encompasses, I believe everybody is trying their best, trying their very possible best to see that this cycle is broken, for people to understand it, that you can live, people living with sickle cell can live better lives. Yes.
And live normal lives too.
Normal lives,
all right,
yes.
Larry, the point there is, when it comes to support and assistance, how much of that is on ground right now, if you can talk to us?
Okay, support and assistance in terms of...
In terms of the finances, in terms of medication, in terms of love, in terms of, inclusiveness, in terms of access, in terms of anything, exposure.
Okay, in terms of finances, medical, health, okay, let's start from generally the governmental angle. Access to medical care for people living with sickle cell, it's not that easy in this part of the world. We're pushing towards that. We're trying to engage stakeholders, especially the government angle, to make sure access to medication is easy. Financing, okay, living with sickle cell actually is somehow capital intensive, and it could be quite expensive. But and that's why we
because
have
of the drugs,
because of the drugs, because of the lifestyle they have to live sometimes, and that is why you have NGOs coming together. Like what we do, we have a free medical clinic. We call it Extra Care Clinic, where we provide free drugs for these people.
All right, Larry, I'm afraid we have to end it here because of time right now. But I thank you very much, General Larry, or let me call you that way, and General Maureen Nwachi, who is also joining us here too. Thank you so much for coming on the program. Thank you.
Yeah.